leading into the therapy, you saw my imaging, you understood my degenerative disc, some of the herniation, some of the inflammation, which for me correlated to, spasms, falling in my backswing and in some of my physical activities. And obviously the goal was to have that eliminated with stem cells, right?
When I saw you in the first time, you have a degeneration change in the lumbar spine, okay?
Correct.
From L3 to L1, okay?
Yes.
That discopatin is a wild discopatin in a lot of patients in the world, okay?
Yeah.
In your case, that intervertebral disc have a broken the posterior part, you right, with a pinches in the right leg. For that you felt and that pain.
For the first 3 months, I felt like there was gradual improvement, where there was days where I'd wake up and I'd move around, I'm like, hey, it's gone. And then there were other days where it's like, it's actually still there. But at the 3 month, 1 week mark,
yes,
the good days kept stacking on each other. You asked me not to golf for 6 months. I golfed at 5.
Yeah.
I felt so good from about the 3 month, 1 week mark to about the 5 month spot. And when I tested it and I went onto the golf course, it was cold. It was a long golf round and I was a little bit anxious doing this. And all I could hear was you saying 6 months, 6 months.
Yes.
I golfed. No symptomology, no pain, no spasms, none of that. Now I was thinking, okay, when I get in the car and I sit down driving home and I get out of my car, maybe I'll have the tightness in the hips of my low back.
Because it's psoas muscle. You have a little bit tired in your psoas muscle when you.
I was expecting it.
Yes.
It wasn't there. And then I think, well, maybe the next morning when I go to the office and I'm sitting down all day and I get up out of my chair, which generally would have pain or discomfort, it would be there. It wasn't. So I can honestly say in the last 4 months, since that 3 month, 1 week mark, all my symptomology is gone. It's completely gone. Now, to be completely honest, I haven't changed a lot in my life.
I told with the patient, okay, no worries for the 2 weeks after the procedure. Why? The first 2 weeks after the therapy, it's possible to feel sore things because the first stop of the cells produces a mass answer, okay? With a little bit inflammation around the muscle.
Right.
That inflammation is important to improve after that the quality of the muscle, okay?
Yeah, thank you.
You're welcome, Nico. And see you soon, okay?
Yes, sir.